Some of these features are going to be the same, like secure messaging, for example, but what does secure messaging do for a patient? All right, so what are the benefits of using remote therapeutic monitoring? I like to frame these questions as one of the previous guests on the podcast has said, you always have to talk about value to whom, the same thing with the benefits. So what are the benefits of RTM or remote therapeutic monitoring? Well, it depends on the stakeholder involved or that you're looking at. So for example, you've got payers, providers, policymakers, and patients. So those are the 4 Ps of healthcare, and each of those stakeholders value things differently within the healthcare process, and they might receive different benefits based off of their location in the value chain, if you would. So I think a lot of the conversation around remote therapeutic monitoring, at least the circles that I see, the outlets that I read and the videos that I watch and the podcasts that I've heard on remote therapeutic monitoring, is very patient or provider centric. So a lot of the conversation is this is going to help providers increase their revenue, increase total potential billable units or billable revenue per patient or per course of care or something of that nature. There's even talk of the patient engagement standpoint and decreasing no-shows and increasing adherence and all of that, providing a better continuity of care. And all of those are great. I just think they've been talked a lot about, so we don't need to dive too deeply into those. But from the provider standpoint, it does help to bill and to capture some of that time that clinicians are currently doing in the clinic, just not being able to bill for currently. What I tell a lot of people is most of the clinics that are looking at implementing remote therapeutic monitoring are doing 85-90% of the work that it takes to bill it. They're just not billing it, and they have been doing that for years. So that is a benefit. And then I do, as somebody that's very passionate about patient engagement and building relationships, I do think there's a lot of benefit there for providers as well to engage patients, to whether it be through notifications, push notifications, or messaging, or being able to update and comment on some of these platforms in real time as patients are out at home, at work, doing their exercises, taking whatever measurements they need to be taking for this platform, using the tool or the device. It's very good from a patient engagement standpoint. I would imagine that you're going to see probably over the next several years research coming out in and around that topic of what does this mean for patient engagement, and are patients that are using remote therapeutic monitoring more adherent to home programs and all of that kind of thing. So those two are two big bonuses for providers. What about the patients though? For patients, again, some of these features are going to be the same, like secure messaging, for example, but what does secure messaging do for a patient? The benefit for the patient is that one, they're getting increased access a lot of times. The patients that have some kind of secure messaging function with their therapists or their physical therapists can potentially get questions answered that prevent them from either going to see another doctor, going into an urgent MD, maybe scheduling another appointment in the clinic, which is all wonderful from a standpoint of decreasing the total cost of care for that specific patient and then the payer as well. So that might be a benefit for the payer. And then the other thing is that they're getting, maybe if there's data visualization on the app or on the software or the platform, they're able to track and see their own progress, which can be very motivating for patients. The fact that there's some feedback or the accountability of knowing that your therapist is logging in and looking and tracking your progress can also be one of those things that helps motivate patients to complete their exercise at home or to take the measurements at home or do whatever it is, use the device. So those are two positive benefits. The other benefit is kind of linked to the first about preventing further appointments or things like that. I'd imagine if you have remote therapeutic monitoring in place, you can begin experimenting as clinics and clinicians, you can begin experimenting with tapering down the frequency of treatment at the latter stages. So, for example, if you have a patient that is coming in and they're coming in 2 or 3 times a week for physical or occupational therapy, maybe you can stand up remote therapeutic monitoring and use it as a way to kind of remove one of those visits or 2 of those visits down the line. So maybe we do very intense 2 or 3 times a week for a couple weeks, and instead of doing that for a full month, we'll do that for a couple weeks, and then we'll begin tapering down, maybe 1 or 2 times a week, and we're making sure that you're progressing through the app, that you have, or the program, the remote therapeutic monitoring, that you're able to message us as needed, and we can kind of troubleshoot issues, so you can actually save the patient time, energy, and money, and also save the payer. So those are a couple really big benefits that I would see for patients. For payers, again, we've kind of mentioned it a little bit, but the idea of reducing the potential for reducing, increased visits or multiple visits or visits that didn't need to happen. The access alone, I think, is big for that. Just sometimes being able to answer a question from a patient that keeps them from going to an urgent MD for an X-ray or something like that, or prevents them from booking another appointment in the clinic because they had a question about their exercise, or their low back was hurting when they were doing the exercise, or something like that. So it can save money over a course of care as well. So those are a few of the benefits that I see with remote therapeutic monitoring. Again, I think it's important to take the view of the benefits for whom whenever we're having these broad discussions around new technology or emerging technology, or integrating it into healthcare in general. So benefits to whom? For the payer, you're getting hopefully some save on preventing visits that don't need to be scheduled. For the provider, obviously you're getting the revenue, you're getting the patient engagement, and for patients, you're potentially saving money as well, and then you're increasing access. For policymakers and regulators, it's getting you data. It's it's bolstering documentation. Who knows? But those are just some of the things in a quick 5-minute, 6-minute video about what I think about remote therapeutic monitoring and some of the benefits.